Okay, so welcome to the talk today, and today is the day three of Materia Medica series. I'm happy. I'm seeing a lot of people. We are right now almost having. I think yesterday we had more than 5,000 people who viewed our lecture, which was really amazing. And that's the idea to spread Materia Medica, going to the depth and understanding remedies to the depth through cases, through clinical understanding, and also through various experiences. So I would also like all of you to participate in it. So when I talk about the remedy, we would really like you to write to us about your observations, your suggestions about the remedy as well. Also, every day I'm going to introduce you to one more Materia Medica book. So every day I'll try to introduce to you some of the clinical things that I do, some of the rare Materia Medicas that we should learn, and hopefully it will help this quarantine period really a lot to go to the next level. And I purposefully don't tell the remedy beforehand because I want it to be a little bit of a learning for you to know what remedy I'm going to teach, because I want you to read, I want you to watch the video and then go back and read all different types of materia medicas, and that will give you a very good idea about that remedy. So what I suggest you to do is to watch my video and then go back, go back, go back to all different materia medicas, and I will tell you which materia medicas to read and how to read, and you can read it step by step, and that will help you really, really, really to go to the depth of materia medica and homeopathy. All right, so I think we are ready for the day. Um, let us start with the case then. This is a very, very simple case. Most of you will get this remedy very, very easily. But we are going to learn a lot about the remedy that we are going to study today. And also, I'm very, very honored to introduce to you one of my, I mean, my favorite homeopaths in the world, that is Dr. Alpesh Oza. And I'm looking forward to his cases because I've seen his journey in last 10 years, and he has just been absolutely amazing. All right, so let's start with the case. All right, so I'm going to read up the case. The cases which I'm telling you are comparatively longer cases, but when I tell you, I'm trying to explain you the case in 5 minutes or 10 minutes. But in real life, the case are not done in 5 minutes. They at least require about 30 minutes, if not more. So, I'm going to read up the case, and at the end of the case, I would like all of you on Facebook and on the Go webinar account to write to me what are the remedy thoughts, and not just the remedy, but why that remedy. All right, and once you know that remedy, I would also like to know what are your thoughts about it. Okay, so let's start. Is my audio any better? Dr. Alpesh, audio is okay? Hello. Is the audio any better? Okay. Anyways, I will just start. I just hope it works okay. So let's start with the case. This is a case of a 45-year-old woman, and I think I saw her about 2 years back, first time. And at that time, when she had come, she was actually in a state of depression, and also she almost had a very, very malignant hypertension. She also used to get a lot of migraines, and she had rheumatic pathology. Okay, so let's try to see the case, huh? So when I saw her first time, and before coming, she said I have blood pressure, and so when we checked the blood pressure, her blood pressure was very high. It was 170 by 100. It was fairly high, and she said this would always remain high. And she described this very high blood pressure, which is connected to her headache, an extreme headache. She describes the headache, which is originated in the neck and the occiput, which is so painful. She says it is a killing kind of state. And the pain is so much that she almost goes into a coma with the pain. So the pain is so much that she has to close her eyes and sleep. It is so painful. She says she goes into a coma, absolute coma. And she has to take so many painkillers. She can't handle it. She has to get admitted every alternate day. It's very interesting the way she describes her pain, where she says that the pain is so much, she goes into a coma. This is interesting to understand the deeper pattern of the person. So when you're trying to do the case taking, it's just not the symptomatology that you're trying to understand, but you're also trying to understand the entire experience of the patient. So your mind is working at both levels. The mind is also working at trying to pick the peculiarities, that is a symptomatic level, and it's also trying to pick up the experience, and here the observation skill comes in. Here you're also trying to look at system. So it has to work on both ways. It has to be like a tandem. Coming back to her pain. So when the BP goes high, it's so much of painful that she says it's almost like comatose state. She says during the headache, I sleep, and in the sleep, I get dreams that I'm dying. I'm dead. In the dream, I am dying with so much of pain that I pray to God that I wish you kill me. Kill me right away. So much of pain. So much of suffering. I want to die right away. So interesting how intense. This desperation also shows a little bit about the state that the person is in. Now we try to understand her as a person, because we understood that the situation is very, very acute. I want to tell you that in the first symptom, don't try to find the remedy. I see a lot of people who tell the remedy is belladonna. That's not a good idea to think about a remedy straight away. The idea is to really understand. My teacher used to tell me, hold on to your horses, my friends. अपने घोड़ों को संभाल के रखना, आगे काम आएंगे. So she describes herself as a very, very sensitive person. Very, very sensitive. So sensitive, slightest thing can affect her a lot. She gets very emotional on smallest of things. And I ask her, can you tell me about this emotional state? And she says that मैं बहुत emotional हूँ. And then she says that this all headache is due to my husband. My husband is alcoholic, and he is a chain smoker and alcoholic, and he tortures me, he controls me, he beats me up, he absolutely destroys me. I'm absolutely tortured by my husband. The situation is such that the husband is a drug addict and alcohol and very, very violent. And he not only tortures her, but even her daughter, her son. He's a maniac. She describes him as he's very, very careless and absolutely selfish. When he gets very angry, he's a smoker. He takes the cigarette and actually kind of puts it in the mouth of the son and puts it in the mouth of his wife, that is our patient. He gets so angry. And this affects her because she just cannot take it, and she almost goes into a paralytic state when the husband gets very, very angry. Can you imagine? The husband comes, takes the cigarette, and puts it in the wife's mouth. And she's totally like helpless and she can't do a thing. She can't say anything because if she says anything, we don't know what will happen. There might be a divorce. What will happen to the children? So she just looks like this and okay. And she almost goes into a paralytic state. You can imagine the state that she is in. You cannot imagine, in fact. Extreme suffering, she says, extreme pain, and extreme torture by her husband. When I asked her to describe her nature a little bit more, she says, I'm a very giving person. I will always go out of the way to help people. Even I cannot see suffering of others. Even if my servant has fever, I cannot see that pain. I will go, I will help. I cannot see other people in problems. That is my problem, she says. She's very scared of hospitals and going in hospitals, she says. For her, the hospital is the worst time. Even looking at blood and she faints. It's suffocating, she says. Even looking at other people in suffering, she cannot take it, she says. I asked her, what is your main feeling? Her main feeling is, I feel totally helpless. I can't do a thing. I have to accept. I'm totally shocked looking at the way my husband is behaving with me. He smokes, he tortures, he hits me, he takes the cigarette, puts it in my mouth, and I can't do anything. I'm just totally paralyzed and totally helpless. What to do? Totally shocked and totally paralyzed. You can see how intense the state is. Then I asked her about her dreams. And she gets many dreams, especially dreams of falling, she says. She's falling from a very, very high place. And she's very scared in the dream. बहुत डर जाती है. Another dream she gets is of death. She not only sees other people's death, she sees her, she is also dying. She experiences a lot of pain in the dream. When I ask her what is the main feeling in the dream, she says total suffocation. I feel totally suffocated. I don't know what to do. I feel helpless. I feel paralyzed. I feel shocked. You can see how intense the state is. So a lot of people are joining, a lot of friends, a lot of colleagues, a lot of students who I probably know of. I can see some of them here. So I'm going to just, for the new people, going to repeat the case in short again so that I can take everyone on the same page. So I was talking to you about this case of hypertension, migraine, rheumatism in a 45-year-old lady who gets a lot of high blood pressure. Her BP goes above 180, and she describes her headache, which is from the back and goes to the eye, and the pain is so much she goes into a comatose state. She describes the migraine so bad that it's almost like a coma for her, and the pain is like torture. In fact, during the headache, it's almost like she's dying. Her BP remains very high, but her issue is that she's very sensitive, and her husband is alcoholic and also a chain smoker and also very violent, and he hits her. He smokes, takes the cigarette, puts it in her mouth, and she's totally like in a blank shock state. She says, I'm totally shocked and totally, as if totally paralyzed. And she's a very giving person. She always goes out of way to help people. Her main feeling is that of helplessness and also of feeling shocked and paralyzed. She also talks about her dream where she's falling. She's falling from a very high place, and she experiences a lot of pain. But her main feeling in the dream is that of suffocation. Totally suffocated. So this is the case in short. How do we analyze this case? So a lot of people are writing different remedies. Staphysagria, causticum. Can this be staphysagria? Yes, it can be staphysagria. Interesting. Causticum. Can this be causticum? Philip Joseph, one of my friends, says it is opium. Interesting. And one more, Dr. Irfana says it's umbellifera because it's kind of a shock state. And many doctors are writing about causticum. I think today's favorite is causticum. And Kali group. Many doctors are writing about Kali group. Can it be Bovista? It can be anything. And one more doctor is writing about Gelsemium because it's shock family, paralysis and shock, Loganici family. And someone is writing about Lycinum. Can this be Lycinum? Bhavesh Thakkarji, one of my favorite friend, is writing Ignatia. Can it be Ignatia? Dr. Rakesh says, can it be camphor? Yeah, camphor is nowadays in air, right? Sudhir Butke says phosphorus. This is phosphorus. Sepia. My friend Elizabeth says it's Papaveresi family. Bharatji says Loganici. And Soham writes Spikily. How are you doing, Soham? And Vansh writes about carcinosin. Okay, so let's see. So how to analyze the case? This is a very, very interesting thing. How do we analyze this case? Where do we anchor the case? In the lockdown period, it's I want that in the coming 15 days, 1 month, you really master materia medica, and you really master the the idea of case taking, case analysis. And that's why I could have done many webinars with different topics, but I felt the need of the hour is to study a few remedies, and God willing, God gave me strength. I will try to continue this kind of materia medica workshops throughout as much as I have strength, and hopefully teach every remedy that I know a little bit about. It's important to know remedies in and out. And when you think about a remedy, it's also important to know how to do analysis. So let's try to do analysis. And in the analysis, first of all, we need to know, where do we anchor the case? This is a very good question. What can we give the most amount of importance on? So what happens is, most of you are totally going into the mental themes. This is why I believe most of mistakes happen. You have to learn to look at the case from all the directions. People who only do mind method forget the physical symptoms, and people who do the physical symptom forget the mind approach. And rest of the people claim they do everything, but actually nothing is happening. So you have to learn the art of using all these different approaches together. And that's why, after spending a lot of time and going through different literatures for many years, this is an approach where you can use all techniques together, which I'm going to share with you. And I will show you towards the end of it how simple it is, and you'll say, this is too easy. We knew this is too easy. So in a case, generally, I try to look at the most peculiar thing in the case. And what could be the most peculiar thing in the case? Let's have a look. So the peculiar thing is the headache. And what is the headache? Because it individualizes the person. That the pain goes from the occiput, extending, yeah, you can see, to the eye. This is the first symptom that you need to look at. And which eye? Right side of the eye. This is the first. You want to pick up the most peculiar thing first. Next, very important. The next very peculiar thing about her, where, see, there are many things. She's sensitive, she's headache, she has blood pressure, she's tortured. So you can take delusion persecuted, or should you take delusion harassed? But this is very much at a superficial level. So one of the peculiar thing is the dreams. And what is a dream? And the dream is of falling. Dreams of falling. Another dream is that of death. Dreams of death. Dreams of death. And also dreams of what? Of suffocation. So when you put all of this together, you can see very nicely in the repertory sheet how I have kind of combined physical and mental symptoms. This is what you have to learn. And now when you look at the repertory sheet, please have a look here. And you can see how this is the artistic form of homeopathy. I want you to learn this art. Ye art aap seekho. That is what is the main thing. And you can see how beautifully the whole pattern, you can see Sanguinaria coming. So interesting, no? The remedy Sanguinaria. But this is not the main thing. One of the main things in the case, which you can think of now, is that the main feeling of helplessness, strong feeling of helplessness, and the main sensation along with it of of paralyzed sensation. This is what is sanguinaria. This is the central rubric of sanguinaria. I want you to learn this. How we analyze the case from the physical to the mental and go to the core sensation. And you can see this is the main core feeling. Helplessness with paralyzed sensation. This is the single drug rubric of sanguinaria. This is what I want you to learn. The artisticness. So interesting. So when you take this is sanguinaria. So that's what I did. What is now interesting also, and I'm going to fast forward it a little bit, that sanguinaria also belongs to the Papaverinaceae family, the family of opium, the family of, so many of you guys said opium, which is interesting, but opium will not help her. The whole totality, and this drug picture which I'm going to teach you, the drug picture I'm going to teach you today is that of sanguinaria. What is the picture of sanguinaria? I'm going to teach you sanguinaria in such a way that tomorrow you will be able to use sanguinaria as much as calcarea carb, as much as sulfur, as much as lycopodium. So the main thing about Papaverinaceae is that of lot of pain and suffering. Like hell. She described like hell, like coma, like torture, like sadism, cannot bear, like a whole violence. And her kind of responses, she can't do a thing. And this is interesting because one of the very interesting rubric in sanguinaria is the famous rubric I'm going to teach you. I'm going to teach you very artistic things. So you can see recognizes, you can see very interesting, huh? Everything but cannot move. And normally we think about cocculus, but you can see sanguinaria there as well. So interesting. Dr. Poonam asks me, what about shock feeling? The shock feeling is also there in Papaverinaceae family. Yes, as much as it is there in Ignatia family. Opium is very well known for shocks. You know that after any electric shock, the main remedy is morphinum. I don't know if you know this. So if you open Clark, I think must have taught you this before. So whenever there is any kind of shock, electric current shock, the main remedy given is morphinum. And morphinum belongs to Papaverinaceae family. So one of the main themes of this family also is shock. This is what I do. I try to kind of connect classical homeopathy to the kingdom approach. I try to connect all approaches together. The keynote approach, the boric approach, the repertory approach, the materia medica approach, the sensation approach, the mind approach, everything together. This is homeopathy of today's generation. We have to learn all approaches together. Gone has been the time where you can only prescribe on keynotes. You have to now learn everything together, because the type of cases are changing. So you will have to learn different methods and different approaches. So interesting. So interesting. So just to explain you a little bit about sanguinaria, I'm going to teach you sanguinaria today, very nicely. So I have given her sanguinaria 1M, 1 dose, and whenever required, I also give her an SOS sanguinaria 1M, which can be used almost 4 pills frequently like a painkiller. And I give this 1 dose every 15 days because I follow up with her every 15 days. And she has done remarkably well. Her rheumatism, her blood pressure, her headaches have remarkably reduced. Within the first dose of her remedy, her headache reduced. And she was taking painkillers 2-3 times a day. In last 6 months, she has not taken a single painkiller. Her hypertension medicine was also discontinued over a period after starting the homeopathic medication. Her state of mind is so much improved now that she can now be on her own, and she doesn't have any violent kind of torturous feeling that she used to get. And we followed it for the coming year, and the treatment with the help of homeopathy, her blood pressure, her headache, everything beautifully changed. In fact, after a year and a half, we even stopped homeopathic medicine. She's so much improved. So interesting. So interesting. So, welcome to day 3 of Materia Medica series, and welcome to understanding out of box. I want you to be innovators. I want you to be innovators of homeopathy. I don't want you to be just a follower. I am follower of no one. I am follower of my own self and the God above, and I study everything. But I don't take anything to heart. I study everything and take all approaches together. So, Sanguinaria Canadensis belongs to Papaverisi family, as we spoke. Let's try to understand this remedy now. Interestingly, Sanguinaria canadensis has alkaloid very close to Chelidonium. Both belong to the same family. The alkaloid is sanguinarine. So interesting. So how do we understand the main genius of Sanguinaria? Let's try to teach you step by step Sanguinaria. So Sanguinaria is very sensitive, very sensitive. In fact, I want to tell you, Sanguinaria in my mind comes very close to very close to pulsatilla. Is very close to pulsatilla, the state of mind. The state of mind of Sanguinaria is very close to pulsatilla. The main symptom of Sanguinaria is given by Kent: rage after slightest insult. Rage after slightest insult. You can see this. Only 4 remedies in homeopathic repertory. One of them being Sanguinaria. Very sensitive, slightest changes in and around, even slightest change of emotions, even to slightest noise, to slightest light. So which shows an oversensitivity, and that's why Sanguinaria state of mind comes very close to pulsatilla. I'm going to try and build a drug picture for you to understand and explain you the picture of Sanguinaria. This is the new Materia Medica pictures which we are developing for last few years. The main genius of Sanguinaria also is helplessness with a paralyzed sensation. A lot of questions about the patient's follow-up. Her mental state was remarkably changed. In fact, she was able to deal with the situation with her husband in a better way. We also did counseling, and later on, they were in much better state. In fact, her son also comes to me, and they are very grateful to homeopathy. There is only so much I can talk about a case in this kind of webinars, because I have hardly half an hour to talk. Yeah. So maybe for some of the workshops we will talk about cases in depth. So helplessness with paralyzed sensation is one of the genius central rubrics of Sanguinaria. This also shows the state where so many things are happening. There is so much of violence in and around. so much of pain, so much of suffering, but I can't do anything. I have to just take it with a pinch of salt, and I can't do a thing. I'm totally helpless. मैं क्या करूं? मैं कुछ कर ही नहीं सकती. This is sanguinaria. Sanguinaria, sometimes you might also think it's close to cocculus, but cocculus is a different ball game, because cocculus also has a lot of anxiety about others, lot of suffering of others, and it's also very oversensitive. But sanguinaria is more helpless. Sanguinaria also can be very clingy. They are very clingy people. So in fact, even in Fatak repertory, in the rubric holding or held desire to be, you can see sanguinaria. They are people who are very, very, very clingy. Let's try to understand the drug picture sanguinaria with the state of mind. Sanguinaria has the dreams of dissecting dead bodies. What do you mean by dissecting dead bodies? It means that the dead body is totally cut. You can understand that kind of pain, suffering, kind of a theme belonging to Papavaresi family. As if dead bodies are dissecting, you can imagine. You can imagine the experience. Dead, pain. You know the famous rubric of Chelidonium, right? Chelidonium and Arnica. Dreams of buried alive, isn't it? I hope you know this. Dreams of being buried alive. This is Chelidonium. Very close to it is dreams of dead bodies dissecting, sanguinaria. So interesting. Very interestingly, they are people with very, very active mind and too many thoughts, and generally they get persistent thoughts, frightful thoughts, vexatious thoughts, thoughts about their past, and whenever they get these thoughts, they get a lot of nausea. Persistent thoughts with disgusting thoughts, all the thoughts of all the torture, violence they have suffered in their life, and along with that, nausea. This is sanguinaria. Thoughts persistent, disgusting thoughts with nausea. Massimo has also given rubrics where they get dreams of snakes, and especially they get dreams of large snakes, which is very interesting. Um, Understanding that sanguinaria comes in the Papavarese family with animals. Frightful dreams. Almost every sanguinaria case that you will see will have frightful dreams. Slightest kind of things, and they will get very many neurological problems, twitching, jerking, sensitivities. Trifles aggravate them. I told you, very, very sensitive. Very often patients from sanguinaria families will tell you, slightest things affect me a lot. छोटी छोटी चीजों से मन लग जाता है. Now I'm taking you to provings. Herring guiding symptom has given this symptom. Sensation as if paralyzed, unable to move while lying on her back with full consciousness of her surroundings. You have to learn to go from rubrics to the provings. Now I'm taking you to most purer form of homeopathy. Learn to understand this. This is the central state of sanguinaria. So interesting. Yes. Very, very useful in hypothyroid conditions, especially. They almost develop a total lassitude, almost no desire to do anything. with a history of very huge fright, typically in Sanguinaria. Due to this shock, this fright, this mental state, this torture, typically Sanguinaria lives in a life with a lot of strong exciting factors. With this kind of fright, there's a lot of incapability to do anything. They can't do anything. Business incapacity for. They develop a kind of a state where they now cannot do their normal things. Another remedy that comes to my mind in this kind of state, hmm? Business incapacity for. So interesting. Just understand how I'm explaining you the whole picture of Sanguinaria. You have to learn this, understanding the picture, and you will be able to use these remedies like polycrust remedies. My teacher from um, my college days used to tell me rare remedies are rare because we use them rarely. They are generally very positive, hopeful of recovery. Sanguinaria. Slightest trifles can cause them anger. I told you about their state of mind or extreme anger, rage. The other thing which I want to talk to you about are dreams of Sanguinaria, which you will see in today's times in your practice very often. Typically, many people um, who require Sanguinaria often get dreams of water. You know, in Kent repertory, the single biggest remedy in dreams of water is ammonium muriaticum. But dreams of water, dreams of journey by boat, dreams of journey with sea, Sanguinaria, very often I've seen. And typically, the main experience in the dream is that of suffocation. So you can see dreams of suffocation. So interesting. I like that many people who I know are watching this Facebook Live and this webinar, and many of them. So, um, my best wishes to all of you. I hope some of you are watching it for knowledge, some people to learn how I am teaching, some people for other things as well. There's a very interesting source of rubrics in Sanguinaria where so much of violence is happening, so many things are happening around them that they are just in a little bit of a paralyzed state. Delusion, talking rapidly all around her are delusion, motion, everything around him is moving. So everything around is so much, too much for her. This is Sanguinaria. So interesting, no? There's almost a loss of sense of time. There's almost the time sense is not so much. You know the reason why I'm teaching you all these remedies, because very often our pulsatilla, our calcarea, our sulfur, our lycopodium are not working. We need to think out of box in some cases, and that's why I'm doing this series. I'm just doing it with a lot of love and a lot of affection, and it's on not only me but our entire team. Dr. Pratik, Dr. Alpesh, Dr. Yash Utsav. This whole presentation is held by Dr. Juhi Malhotra, also Dr. Shivani, and many others help me. Dr. Srishti, Dr. Anisha Gangwani. Many people are helping me. So interesting. Generally, one of the confirmatory symptom when I give sanguinaria is how do you react to eructation? And generally, eructations ameliorate is a very, very strong symptom of sanguinaria. And if you study it really well, sanguinaria, it has state of mind like ranunculus, like pulsatilla, like staphysagria, indignation, mental and emotional consequence. You can see here sanguinaria. I explained you about this rubric where the idea that everything around is so much of suffering that I kind of recognize it. I understand it, but I can't do anything. This is recognizing but cannot move. A very famous symptom of sanguinaria also is that of damp weather aggravates. So now the weather is not come up to damp weather, but when the rainy weather starts, along with rustox, a top remedy is sanguinaria. So today, now I'm going to teach you a little bit about the physical symptoms of sanguinaria and how we can use it. We all know headache on the right side is sanguinaria, but I'm going to teach you much beyond this. So sanguinaria typically is a like we said, it's a right-sided remedy. Typically, very, very important remedy. We spoke about the entire mind state, but also it is a totally right-sided remedy, especially affecting the right side of the head and liver. This is important because this right-sided remedy with liver makes it a very, very close remedy to chelidonium. Very, very close because right-sided with liver also chelidonium. It's important not to only know mind symptoms, it's important to know physical symptoms, it's important to know peculiarities, it's important to know clinical rubrics. I use all of this together. This is what is needed in today's times. It also has a very important action on chest and deltoid. Very, very often sanguinaria has pathology of vasomotor responses, a lot of circulatory pathologies also you will see in sanguinaria. One of the genius of sanguinaria, if I have to explain you, is burning heat. Jalan. Almost every case of sanguinaria will have this kind of burning. Crazy, crazy form of burning. Burning is a genius. You can see burning heat ebullition, burning in throat, chest, sternum, soles, burn feeling in the tongue. In fact, many cases where nux vomica is required for heartburns. But typically, with this heartburn and this kind of burning with the headache of right side, think about sanguinaria. So interesting. Also, sanguinaria, headaches, migraines, I spoke to you about. I showed you this beautiful case of headache. Typically, will have right-sided headache going towards the occiput, which makes it of a very, very interesting remedy for not just migraine but even cervical spondylosis. Vertigo, worse looking up and moving the head. But a key note is headache if he goes without food, like cactus, like sulfurum iode. But all the headaches, typically patients who require sanguinaria will often say, I get a lot of headaches and I feel like vomiting. And if I vomit, I feel better. And I have to sleep. And I have to typically sleep with lights off in total darkness. This is sanguinaria. I have confirmed as almost all cases where sanguinaria was required. The other important thing that I want to talk to you about sanguinaria, is very peculiar symptom of shoulder, of deltoid, of frozen shoulder. Almost every patient who require sanguinaria for the shoulders will tell you, I feel better after doing like this, swinging the arm to and fro, and you can see this very peculiar symptom. Pain in the arm better by swinging arm to and fro. So peculiar. It's also a very important remedy, not just in climaxes, but especially in many female problems, including uterine polyps. You know, in nowadays, more common than uterine fibroids is uterine polyps. So sanguinaria along with Formica rufa are top remedies for uterine polyp, and especially this uterine polyps in females when it is combined with, when they are getting it during the climacteric at the age of 45, 50, with this heat flushes, with this pain in the right nipples going to right shoulder. Think about sanguinaria. Very important remedy. So peculiar. It's a very important remedy for gastroesophageal reflux, where they are spitting bile, spitting with bile coming out. Lot of nausea, lot of salivation. Better after eating. It's typically spicy, typically sanguinaria. I told you about its importance in liver pathology, not just in fatty liver, but even CA rectum, along with the remedy Cardus marianus, along with the remedy Ruta, along with the remedy Solanum tuberosum ergotans, CA of the rectum. Think about sanguinary. But it's a very important remedy for gastroesophageal reflux. I think it's a lesser used remedy in that time. Lot of burning, lot of sore sensation you see in this remedy. All symptoms are better by lying on the back with head high. Remember this. Sanguinaria typically will have this symptom, lies on the back with head elevated. So peculiar. I'm not telling you very common symptoms where sanguinaria has pain which increases, decreases with sun, where after stopping of Qatar there is diarrhea. This is something that you already know. This is given in Allen's keynotes, and we are not going to waste time talking about it because you already know that. I'm trying to give you pictures which I have seen. These are new age drug pictures. Everything is better after passing flatus, and especially lying on the left side. These are two very important symptoms: passing flatus, lying on the left side. And obviously, periodically aggravated with sun, climax is 3 a.m. like Kalika. And especially shoulder patients who say that they are better after raising the arms. But I want to tell you one clinical hint for many young students there. And I remember this clinical experience of one of the very old homeopath. One patient had come who came with a lot of asthma. And when asked how did the asthma start, they said it started after some kind of pesticide control or some perfume or some kind of painting that happened. Also, due to some kind of flowers were brought in the house. And this is the main symptom, very important symptom of sanguinary. Very important symptom. You can see this probably. I will show you in Kent repertory. Let's see, asthma from odors or rose gold. And when you get this, when you get this symptom, you can give Sanguinaria 1 m frequently, and that asthma can go down in seconds. It's a very, very important remedy for allergies and asthma. Especially this kind of asthma, not just from odors, which shows its allergies, but also from many, many emotions after eating, like kalika. So peculiar. Many of the students are asking me which repertory should we use. First, learn Kent repertory. Everything after that. First Kent, first Fatak, first Boric, first Allens. Then watch my videos and I'll tell you everything later. But yeah, first do the basics well. First do the basics really well. Master the basics. Become a king of basics. Yeah. So interesting. I'm going to go a little bit faster now. Like I told you, typically, right shoulder pains aggravated at night is sanguinaria. And I told you, palms, which are patients who come with palms burning during the climactic time, also sanguinaria. Very often, patients who come with fibroadenoma or some kind of mammary cyst during climaxes, think about sanguinaria. Mammary swelled in climaxes, mammary hypertrophy in climaxes, any kind of skin problems with menses. When it is combining, think about sanguinaria. It's a very, very important female remedy. So interesting. I'm not going to tell you much about the headaches because you already know about it. So I'm going to come a little bit towards the end of my talk. So for people to know about sanguinaria and the experience of sanguinaria, of so much of pain, so much of suffering, I want to put across a very short video that I was trying. The kind of pain and suffering that this remedy here, sanguinaria, actually experiences. So this was a little bit about sanguinaria. I tried to give you a little rough picture about sanguinaria. I want you guys to watch the video, to watch my talk. And then once you finish watching my talk, I want you to read the same remedy from Allen's keynote, then from Fatak, Materia Medica, then from Kent, Materia Medica, then from NM Chaudhary, then from Farrington, Materia Medica, then from Kent repertory, find out the rubrics which have sanguinaria in it. Then go to Herring guiding symptoms and Allen's provings, and then Hahnemann if the literature is available. So I want you to study the same remedy today, sanguinaria, read it from all these different books and write to me what you learned. And then you can also email me. You have my email ID, gaurang@gmail.com. Please write to me how you are liking the Materia Medica series that